Congratulations on the birth of your new baby. I'm Dr. Tim Watson, a pediatrician here at Parkview Medical Center, and these are my kids, Timmy, Alexander, and Marika. Here at Parkview, we know that you are committed to providing the best for your baby, and that is why you've chosen to breastfeed your infant. The American Academy of Pediatrics recommends babies be exclusively breastfed for at least 6 months of age, and preferably up to 1 year. This means that babies are fed only mother's milk and are not fed any other liquids or formula. Babies who receive only mother's milk are less likely to be overweight, have less constipation and colic, and they visit their doctor less for illnesses such as colds and ear infections, asthma, and allergies. They are also less likely to have sudden infant death syndrome, or SIDS. They're less likely to have colitis and childhood cancers, and they have a higher IQ and superior growth and development. Breastfeeding has benefits for you also. You will lose weight, cut your risk of breast and uterine and ovarian cancer, and have less heart disease and diabetes. During the first few days following birth, you have a small amount of colostrum, a perfect first milk for your baby that contains all the nutrients and protective factors your baby needs. Your baby's tummy is the size of a large marble and doesn't need a lot of milk to be full. Your baby does need to suck, and frequent trips to the breast ensures a good milk supply and helps your baby learn to breastfeed. Babies that want to breastfeed often are not necessarily hungry, but they feel comforted at the mother's breast and enjoy suckling. Many mothers worry that their baby is not getting enough to eat because they don't see a lot of milk in the first few days. How can you know if your baby is getting enough? Well, your baby needs to have a certain amount of wet and soiled diapers every day. We are keeping track of these diapers and have a feeding and diaper log which will help you track the number of wets and poops your baby has. On day 1, we expect only 1 wet and 1 poop. On day 2, 2 wets and 2 poops. These will increase each day until day 6, when you will have at least 4 yellow poops and 6 to 8 wet diapers per day. Your baby will also be weighed each day you are in the hospital and at your follow-up visit with your pediatrician a few days after discharge. It's normal for your baby to lose up to 7% of their birth weight in the first 4 days. They'll soon gain it back and more with the help of their mother's milk. Introducing a bottle of formula to supplement while breastfeeding affects breastfeeding in a number of ways. It reduces the amount of milk you make because the baby is not breastfeeding as often or as long, which affects milk supply. Many babies quickly develop a preference for bottle feeding due to the quick flow of milk from the bottle and the longer, firmer nipple. They begin to pull off their mother and demand the bottle. This results in breastfeeding being discontinued or shortened, which affects the long-term benefits of breastfeeding. Bottles of expressed breast milk may be introduced later after breastfeeding has been established. Formula also causes an inflammatory response in your baby's intestines, increasing your baby's risk of infection. It's best to avoid formula unless medically necessary. Your pediatrician and nurse will let you know if your baby has a temporary need for supplementation due to a medical concern. In order to provide formula to you, you will need to sign a consent form for non-medical use of formula. This is to ensure that you understand how formula may affect your baby's health and your breastfeeding relationship. Please let us know if you have any concerns about breastfeeding. Our staff has had special training in lactation to help breastfeeding get off to a good start and to address any problems which may arise. We also have an outpatient lactation clinic to assist you after you've been discharged. Your baby will thank you for doing your part in giving them the gift of only mother's milk.